Good morning all. What we're going to try and do in this session is really try and think about the impact of neuroendocrine tumours on our patient community, and also how we can try and bridge that gap. And there's lots of gaps that need bridging. One of them is the information gap, which obviously I will talk to you very briefly about now. The other one is not just about information and access to information, but when to give it to the patient, what would be the right time, and Jo will be presenting on that. Then I'm going to just share some experience of education to healthcare professionals that's happened in the UK, and really some of the challenges and some of the lessons learnt from that. And then Kim is going to speak to us about the unmet need for psychological support, which we see very clearly in the UK, and we're very lucky to have Kim and her colleague Steve, who supports both the men's organisation and mine and supports patients in the community. So very briefly, and I apologise for membership because obviously we heard a lot of this yesterday, we did have some very interesting discussions about awareness, certainly not information, so quite heated discussions, but I think we got a lot done, and I'll share with you what the end result of yesterday was. So what we know from our unmet needs survey, of course, was that there was a lack of information for patients on various things, but one of them being on how they manage their condition, and that there was a huge unmet need for information and access to psychological care. So really this session is based around those two things. So the first thing that we've decided to move forward with as an organisation is the Global Patient Information Pack. Now obviously we're very aware that most of the organisations have excellent patient information, but there are a huge amount of people who have, one, not access to an organisation that some of us might run, and that also don't have access to reliable information, kind of relying a little bit on Dr. Google, and we see that a lot. And I think it's something that as a global organisation we feel quite strongly that it's something that we can achieve by amalgamating all of the information that we know everybody's produced and putting together some very simple sort of top-line fact sheets, if you like, covering all the different types of neuroendocrine tumour. So the phase one was looking at what neuroendocrine tumours that we should be looking at, and then really trying to bring together the information and provide really something that could be used across a global community. And that is actually quite a challenging thing, because in each different country there are of course various different rules and regulations and access to treatments and guidelines from different societies and organisations. So the very important thing, of course, would be to ensure that we had all of the information that we're providing has been sort of looked at and signed off by our medical community too. So this is the phase one fact sheets that we're going to look at, and that's the list there. And then we're going to sort of provide more information on those fact sheets and develop them slightly. And this is going to be a 3-year project. And we've decided to look at carcinoid syndrome, carcinoid crisis, carcinoid heart disease within sort of probably the first 18 months, and then further details on treatments, MDTs, different surgery, medical management, liver-directed therapies, symptom control, nutrition, and of course living with neuroendocrine tumours. Obviously, what's very important as a global organisation is that we provide things not just in English, so that it becomes useful for everybody. So we will translate these fact sheets into 10 languages: English, Spanish, Italian, French, Arabic, Chinese, Mandarin, Japanese, Russian, German, and Hindi. They will be at different levels. So I've talked about kind of the development of the fact sheets. We'll have a top-line level. Interesting for beginners. I think maybe that's a weird word to use, sorry, but it's not my slides. But maybe those that are newly diagnosed, and then we'll move on to those that maybe have more experience of living with the disease and would like some more in-depth information. And of course, we'll produce relevant media around the fact sheets, like infographics, videos and diagrams, so that it's not just all words and figures. So our principles of work for this is we're aware it's quite an ambitious project. So obviously we're not going to produce massive folders and books, and they will be fact sheets. And it's a very clear 3-year project, and multidisciplinarity is absolutely key. So we will have a team of representatives from INCA, members of the medical societies from around the globe, specialist nurses, which of course we feel is very important to include, specialist dietitians, really a huge area of interest for our community, and also potentially bring in people like psychotherapists in order to talk about some of the areas of living with that we need to be focused on. So that will be, we have, I think, one draft of our first fact sheet available now, which is on pancreatic nets. So we will be reviewing that and then reviewing that with the Global Task Force in due course. I don't know what the timelines on that is.
In about the next, well, we'll be reviewing that. I think I've already reviewed the first, or we've reviewed it, and then I think we'll be sending that around in the next few weeks.
Okay. So I think we hope to have maybe a couple of fact sheets out by Net Cancer Day this year, so that we can launch this as part of our information pillar. Something else that we need to focus on is our website, and we talked about this in detail yesterday. There are various changes that need to be made to this. It's our forward-facing platform. It really is what INCA is about, and it's the first place that people are likely to go to. So it's really important that we get that right. We have various content updates to deliver upon. Our projects, which are our SCAN project, our NET clinical trials and research work, our research boot camp, and of course the information packages, which are these fact sheets, which we will be developing over the next 3 years. And we also need to change the medical information that's on that site to make it relevant and up to date with new terminology and changes to treatment pathways. We need to ensure that the branding is correct, and I'll mention a little bit about that later. At the moment, we have a lot of separate social media activity around Net Cancer Day, but we actually don't have a social media platform for INCA itself, so we need to amalgamate those together. We need to ensure our membership is fully updated so that everybody knows where they can go for local resource and support. We need to ensure that what INCA does is very, very clear on our website. We all have organisations where we provide various different activities, and we have different remits across the globe. But one thing that INCA can't do is obviously provide medical support to the global community. That's not something that we have capability or resource to do. I have taken a few emails that we've got for people that are concerned about certain health issues, but that's unsustainable. So we just need to be very clear that what INCA is as an organisation is there front and centre on the website. And we really have to think about language. Obviously our ideal scenario is that the website would be in multiple languages, but that is really around finance rather than anything else. It's certainly a huge wish of the whole organisation. Our social media priorities, you can see there. We have quite a lot to do on social media to try and ensure that we gain momentum throughout the whole of the year. We need to understand what has worked and what has not worked at the moment. We obviously have huge impact around Net Cancer Day, but the rest of the year, I would say, has quite a minimal impact, and we need to change that. We need to build an editorial calendar, ensure that the content is relevant for all net types. We also need to ensure that INCA projects are very clearly put out across social media. We need to involve all of the member organisations. INCA isn't a one-man band, it's an organisation of all of you great people, and we need to make sure that all of the work that everybody is doing is certainly out there on social media. And I think we talked yesterday about trying to ensure that that was in some cases in local language, so that we can start bringing more people on board and higher and increase our engagement. At present, our social media audience is healthcare professionals and patients, caregivers, relatives, friends, and the general public. We have an 8% increase in subscribers last year, but our Facebook posts, for example, not on Net Cancer Day, are only around 18 per month, with about 5 likes and 2 unlikes per day. Our core group presently is 65 years of age and older. It is predominantly female, and it is USA predominant. And this is why we're talking about the fact that the community really needs to get engaged with the social media plan so that we are covering the whole globe, as this is not a USA organisation. And of course our top activity will be Net Cancer Day. The hashtag Let's Talk About NETs has been hugely successful for Net Cancer Day, and it's gathered a lot of momentum with 12.2 million impressions across Facebook and Twitter last year. So that's the most that we've ever had, so it's been hugely successful. Our current posts and topics, I think we felt are a little bit too reliant on Nettie, which is kind of the cartoon character representing INCA in some cases. And we do need to look at other tools and other content. And we need variance, we need relevance, and we need impactful content. We have newsletters that we send out every month, which I'm hoping obviously everybody is subscribed to. We have about 1,374 subscribers. We have 3 subcategories. And again, this is something that belongs to the whole community. So we really need to get input, and we're very reliant on that, or we don't have any content. I think once we develop a social media plan, we'll be able to feed through all the content from social media onto our newsletters. We're going to be providing a clear template for the community so that they're fully aware of what's expected of them. And we're certainly going to do some feature articles on some of the new memberships and maybe some of our scientific collaborators too. So finally, just Net Cancer Day, which is probably our key awareness pillar. We had various conversations yesterday as to what that was going to look like this year and moving forward. There was discussions about whether we should keep Net Cancer Day, Neuroendocrine Tumour Cancer Day. It doesn't make an awful lot of sense. I did try to get that change yesterday, but it was a big fail for me. So there was a decision that we would continue with Net Cancer Day, and then throughout next year we're going to look at some focus group work and try and understand what the community would feel would be a more appropriate title for this and for this day. So we will do that. Over the last 3 or 4 years, we've also had cups that we've been using to raise awareness in cafes and at various events. We've decided that this year we should abandon the cups, and we will just go back to developing some more of our Net Cancer Day pins. They'll be bigger than the previous ones, but they'll be free to all of the membership and something that everybody can use. And of course, we will need to think about what's going to be our focus. One of the main focuses of this year for INCA and for communications is to join INCA and Net Cancer Day together. So obviously there will be a huge awareness push about that INCA owns Net Cancer Day. But also we needed to look at some of the other projects that we're working on. And Derek shared with us what he's leading on as a project called the SCAN project. And that's a project all about access to treatments, access to specialist nurses, access to hospitals, the cost of treatment for our community. And we felt that was a really important project that we could then use as really our main theme for Net Cancer Day this year. And we will be doing some video shoots throughout the next couple of days of our organisations, just sharing on video what access means to them. And then we will provide a collage on the day with hopefully some results of the survey. So I think that's what Net Cancer Day is going to be looking like this year. And I think that covers what is going to be our information and awareness pillar for this year and for the next 3 years.